Comparing phase 1, 2 and 3. Phase 3 is overall the best phase. Maximum failure rate is phase 2. Bridging trial. Bridging trials means first we do drug testing in Europe. So we do there phase 1, phase 2, phase 3 and phase 4. Drug is published there. But if we want to make that drug available in another country, suppose India, so in India we again have to do phase 3. So phase 3 is bridging between two countries. Difference between efficacy and effectiveness. So efficacy is we find therapeutic effect under controlled condition, but in effectiveness we make therapeutic effect under real world scenarios, means uncontrolled. So phase 4 gives effectiveness and phase 2 and 3 gives efficacy. Design of trials. RCT. RCT is randomized controlled trial. We test a drug in 100 patients. So and 50 are given the test drug and 50 are given the control. Control means we give the best gold standard treatment of that gold standard drug of that treatment. And if the drug is not found for that treatment, we give patients are unaware of treatment group. It is called single binding. When doctors are also unaware about the treatment, about the and it is called double binding. Binding reduce the bias, means false results. False results are errors of are two type, alpha and beta. In alpha error, actually the drug is not effective, but result shows that drug is effective. In beta error, actually the drug is effective, but the result shows it is not effective. How to reduce error? By doing RCT and binding. 10 types of drugs. Number 1, placebo. Placebo is a dummy drug. It does not have the active drug. Normally the drug is active drug plus excipient, color, taste, shape. This is called the taste drug. In placebo it looks same like this, but it is inert chemical, and excipient is soil, but there is no active drug. Advantage, it allows blinding in trial, and placebo rules out psychological effect of drug. Sham surgery is a fake surgery. We do it for control purpose. Orphan drugs. Orphan drugs are drugs for rare diseases. Definition of rare disease in India is if prevalence of disease is less than 1 per 5 lakh population. It is called rare. Government provide incentive money to pharma company to make orphan drugs. Rare disease orphan drug. Digoxin poisoning, it bind, it is antidote. And for SCID, EDA replacement. Essential drugs. Essential drugs are the common drugs for common diseases. Definition is drug that satisfy prior- priority healthcare needs of majority of population. Characteristics of common drug. Essential drug is available to at all time, in all dose form, in all formulation, and it must be cost effective. So government regulate the price of only essential drugs. NPPA, government body. The drug must be single formulation. It must not be combined with another drug. Combination makes the drugs more costly. So WHO takes out a list which are the essential drugs. So every 2 years. The first deal was in 1977 and the latest was in 2023. So WHO gives adult essential drugs number to be 502 and child essential drugs to be 361. In India, NLEM, National List of Essential Medicine 2022 gives 384 drugs. And the fourth one is fixed dose combination. We do combination of two drugs in a single formulation. 2 or more than 2. So there are two type of FPC, rational and rational fixed dose combination and irrational fixed dose combination. Synergism, additive and supradditive. Supradditive example is cotrimazole. It is combination in sulfur drugs and trimethoprim. Not sure. Let's see. When we do also do combination to reduce the side effects. For example, epanzan plus cetirizine reduce nephrotoxicity. Resistance is reduced. For example, if we give only amoxicillin, the bacterial resistance is reduced. So we also give clavinic acid. If a person forgot to take one drug, then the resistance might also develop. So in TB we go for 4 drugs in one tablet. Irrational FDC includes acetazole, irrational FDC. There is high side effect. The cost is also high. The main purpose of irrational is to increase the cost. The pharmacokinetics of a drug is also is different. If the pharmacokinetics of a drug is different and we do FDC, it is called irrational.